In this video, we will identify the difference between rheumatoid arthritis and osteoarthritis, causes, risk factors, symptoms, diagnosis, and treatment of both. Osteoarthritis and rheumatoid arthritis are two different types of arthritis that affect the joints but with different causes and slight differences in the symptoms and treatments. Let's first talk about osteoarthritis. Osteoarthritis is a degenerative joint disease or wear and tear of the protective tissue or articular cartilage that covers the ends of the bones at a joint. The damage to the cartilage may lead to possible development of bone spurs or osteophytes, pain, stiffness, and reduced joint mobility. There may be little or no swelling, decreased range of motion at weight-bearing joints such as the knees, hips, spine, hands, and fingers. Osteoarthritis symptoms may worsen with activity and improve with rest. Common risk factors for osteoarthritis include aging, obesity, injuries, and repetitive stress on the joints. Symptoms of osteoarthritis may include pain, stiffness after a period of inactivity, as in the morning or after sitting for a long time. Little or no swelling, joint deformity, reduced range of motion, and crepitus is common. Osteoarthritis can be diagnosed through physical examination, blood tests to rule out rheumatoid arthritis, and imaging tests. Treatment for osteoarthritis may include symptom management through physical therapy, low-impact exercises or lifestyle modifications to reduce weight, pain relief medications, and surgery in severe cases. Now, let's talk about rheumatoid arthritis. Rheumatoid arthritis is a chronic autoimmune disorder in which the body's immune system attacks the body's joint tissues. In other words, the immune system sees the healthy synovial membrane within the joints as a threat and, therefore, attacks it, causing severe inflammation in the synovium, synovitis, in the affected joint, destroying the articular cartilage that supports the smooth movement of the joint. It can affect other body systems like the heart, the eyes, or the lungs. But it mostly affects joints. It can be the wrists, hands, elbows, shoulders, feet, ankles, knees, hips, spine, neck, or jaw. Joints aid body movement, flexibility, and weight-bearing. Without early intervention in rheumatoid arthritis, the space between the joint can narrow or fuse together over time, ankylosis. Rheumatoid arthritis can be diagnosed through physical examination, blood tests, and imaging tests. Rheumatoid arthritis mostly affects the joints symmetrically, meaning if the joint of the hand is affected, it will affect both the left and right hand. The cytokines released during the autoimmune attack cause inflammation and fluid buildup in the joint. Rheumatoid arthritis is characterized by fever, anemia, fatigue, loss of appetite, chronic pain, swelling, stiffness, decreased range of motion, and deformities or loss of function in the affected joints. Even though the exact cause of rheumatoid arthritis is unknown, research identified some possible factors that can contribute to the development of rheumatoid arthritis. It has been established that genetic predisposition plays a crucial role in the development of rheumatoid arthritis. The human leukocyte antigen (HLA) gene is a complex of genes that helps the immune system distinguish between the body's cell surface proteins and foreign cell surface proteins. Mutation or change in the human leukocyte antigen complex can cause its malfunction, leading to the development of autoimmune disorders like ankylosing spondylitis, celiac disease (CD), multiple sclerosis (MS), systemic lupus erythematosus (SLE), Sjogren's syndrome (SS), type 1 diabetes mellitus, and rheumatoid arthritis. Other established risk factors associated with the development of rheumatoid arthritis include dust, viral or bacterial infections, and long-term smoking. Early diagnosis and treatment of rheumatoid arthritis is crucial to prevent joint damage and improve patient outcomes. Rheumatoid arthritis can be diagnosed through physical examination, blood tests, and imaging tests. Rheumatoid arthritis can increase the risk of atherosclerosis and inflammation of the pericardium, pericarditis. People with rheumatoid arthritis have an increased risk of inflammation and scarring of the lung tissues, pulmonary fibrosis, leading to respiratory disorders like shortness of breath. Rheumatoid arthritis also increases the risk of developing lymphoma or cancer of the lymph system. Rheumatoid nodules or firm bumps of tissue around pressure points and other parts of the body, including the heart and lungs. People with rheumatoid arthritis are much more likely to develop Sjogren's syndrome or decreased moisture in the eyes and mouth, dry eyes and mouth. Inflammation in rheumatoid arthritis can compress the nerves of the hand and fingers, causing carpal tunnel syndrome. Rheumatoid arthritis, together with some of the medications used for treatment, increases the risk of developing immunosuppression and infections, osteoporosis or weakening of the bones and susceptibility to fracture. There is no cure for rheumatoid arthritis. However, disease-modifying anti-rheumatic drugs, DMARDs, are mostly used to treat or manage rheumatoid arthritis, to slow the disease progression, joint damage, and malfunction. Janus kinase (JAK) inhibitors are another class of drugs used to treat rheumatoid arthritis to inhibit cytokine activity that causes an inflammatory response. Short-term use of corticosteroids can be employed to reduce acute inflammation in rheumatoid arthritis flare-ups. However, long-term use is generally discouraged due to potential side effects. Alternative rheumatoid arthritis therapies may include acupuncture, Tai Chi, a slow and intentional movement or exercise combined with meditation and breathing, healthy eating, relaxation techniques, yoga, massage therapy, taking omega-3 fatty acids, exercise, heat and cold therapy, hydrotherapy, aromatherapy, and biofeedback. Another natural way of managing rheumatoid arthritis is by eating an anti-inflammatory diet, including fruits and vegetables, whole grains or fiber-rich foods, lean protein, healthy fats, spices, and foods containing omega-3 fatty acids in the diet, and limiting processed foods, red meats, and alcohol consumption. In summary, rheumatoid arthritis is an autoimmune disorder that affects the joints and other body systems, while osteoarthritis is a wear and tear or degeneration of the joint cartilage. Both rheumatoid arthritis and osteoarthritis are more common in women than men. Rheumatoid arthritis may begin suddenly at any age or time in life, while osteoarthritis usually has a slow onset and may occur late in life. In rheumatoid arthritis, the joints are painful, swollen, stiff, and occurring in the joints of both sides of the body. Osteoarthritis may be limited to one or more joints but not necessarily symmetrical. The joints may be tender and painful with little or no swelling. Rheumatoid arthritis may present with whole body symptoms and morning stiffness, usually lasting more than an hour. In osteoarthritis, whole body symptoms are absent, and morning joint stiffness may last less than an hour. Stiffness may return later in the day after periods of activity. In rheumatoid arthritis, symptoms are worse with rest but improve with activity. While in osteoarthritis, symptoms may worsen with activity but improve with rest. However, low-impact exercise is recommended. Thanks for watching.